Welcome back to the Adelphi Breast Cancer Program STEP videos. I'm Dr. Avner Hershlag, and this is part 2 of my discussion of fertility preservation for breast cancer patients. We'll start with genes. So genes that cause breast cancer are quite common in families with a very significant history of breast cancer, especially in young members of the family. It is considered to be about 10% of breast cancer that it is genetics. However, I do think that it's more, and I think simply that it's not a higher percentage because in many cases, genetics is not being done. Most of the genetics is the BRCA gene, but there are other, in fact, many other genes that can cause breast cancer. The BRCA mutation in the general population is only in 1 in 400 to 800 people. However, in certain ethnicities, and especially in Ashkenazi Jews, it is much more frequent. As frequent in Ashkenazi Jews as 1 in 40. It's a very, very common gene, and maybe every Ashkenazi Jewish person, man or woman, should be tested. Let's remember that it comes equally in men and women. It is not sex-linked. The lifetime chance of women to get breast cancer is about 12% to start with, even if they don't have a cancer gene. With the BRCA gene, that incidence goes way up. Up to the age of 50, about 30 to 40% chance of breast cancer. But when women get up to 80, it is lifetime of over 80% chance of getting breast cancer. For women who carry the BRCA gene, there is a significant but low percentage of ovarian cancer appearing before the age of 50. However, it climbs up to about 40 to 50% in some cases by the age of 80. Luckily, we don't have the accurate statistic for one good reason, and that is that BRCA carriers, many of them, by the age of 80 already have had their ovaries removed. It is recommended typically to remove the ovaries when you finish your childbearing, and typically not more than 40 years of age. If you carry a BRCA gene or any other cancer gene, we can actually test your embryos through a process called PGTM. So you need to have IVF, and we need to do special testing on you. And then when the embryos reach a stage, usually day 5 or 6, we can biopsy, take a few cells out, send them to the genetics lab, and test them for the BRCA gene or any other cancer gene. Those genes are usually dominant, meaning that it is expected that half of the embryos will have them, and therefore it's extremely important to find them in the embryos and transfer an embryo that does not have the BRCA gene, and therefore your offspring, your child, will not have an increased chance for breast cancer, ovarian cancer, and even if it's a male, some cancers that are at an increased frequency even in the males. On day 5 or 6 after the egg retrieval, the embryo is called a blastocyst, and here you see a biopsy done under the microscope where a few cells are removed from the embryo. The embryo gets frozen, and then we wait for the results from the genetics lab. Anjali was 26 years old when she came to my practice, a single woman with a partner who was 31 years old. She had a 2-centimeter breast mass that was triple negative, meaning the receptors were negative for estrogen, progesterone, and HER2. And she was tested for BRCA and had ACT and then surgery. So chemotherapy was first. And what we did was we got 20 eggs, and I advised her to freeze half of the eggs as eggs and half of them to make embryos with her partner. Now, this is a typical case, and that shows you the change in what has happened in breast cancer treatment. In the earlier days, almost all breast cancer patients had surgery first, followed by chemotherapy, usually about 6 weeks later. The surgery, whether it was mastectomy or even lumpectomy, necessitated having the patient completely heal before chemotherapy starts. And that gave us a relatively wide window of opportunity to preserve eggs by doing a full IVF cycle, giving the patient medications typically for 10 to 12 days, followed by egg retrieval, freezing, fertilization if it was necessary. That changed, and now most breast oncologists and surgeons advocate doing chemotherapy first before surgery, and that's called neoadjuvant therapy, with the purpose of reducing the tumor and then going on to definitive surgery. Potentially, that shortens the window of opportunity that we have to do fertility preservation. But it is an opportunity, and I love this quote that says, if a window of opportunity appears, don't pull down the shade. And this is a message for the doctors and breast cancer patients alike. Studies that have been done have shown that by doing fertility preservation prior to chemo, we are not reducing the chances of survival in patients. That is, now we have like solid statistics to show that. And I'll tell you what the only delay is the delay of referral. So still there are some doctors, both oncologists and surgeons, that either don't refer to fertility preservation at all, or are late in referral after the patient has had multiple testing, and therefore reducing that window that we have to treat the patient safely, get eggs, get embryos frozen before their capacity is diminished by the treatment, and then send them straight to treatment. My priority is always the breast cancer. I just want you to understand very clearly that this is the priority. We work very closely with our colleagues, the oncologists and the oncologic surgeons, who I think have developed full awareness of their patients needing fertility preservation and of our technologies that are available. So this 40-year-old patient was a second marriage. She married her high school sweetheart after she had a failed marriage, and she came with a mammogram that we did after she presented, and we actually found that she had minimal cancer. She had DCIS and had a left mastectomy and had a reconstruction, and was also positive for estrogen and progesterone receptors and started tamoxifen. 2 years later, she was cleared by the oncologist to come back. When they clear you, what they do is they ask you to get off the tamoxifen, usually wait a few months until it clears from your system, and then you can start fertility preservation, actually fertility treatment at this point, because they allow you to get pregnant. And she had a low ovarian potential, was asking me, what are my chances to get pregnant, and is it really safe for me? Well, a study that was done, a very large study that was done in Scandinavia, is very reassuring. Since survival of over 7,500 women with breast cancer for 5 years was 87.5%. Almost all patients who had pregnancy 6 months or more after the diagnosis of breast cancer had no difference in survival rate. So how safe is pregnancy after breast cancer? Well, it's been found again and again that it does not increase cancer recurrence rate. May even be protective according to some studies. Early pregnancy within 2 years is unlikely to affect prognosis. The current recommendations is to be on tamoxifen at least for 2 years, but this is an individual decision that the breast oncologist and the breast surgeons have to make. And we also know that offspring health is not compromised and that breastfeeding is safe. So Olivia decided on donor eggs using the egg bank on a natural cycle. She had 6 eggs that were thought out. All of them survived, and she conceived after 1 embryo that was transferred on day 5 and had a baby girl who is now 3 years old. I want to wish all breast cancer patients who are watching this video good luck for the next chapter in your life. I hope I've made it clear that you will be an amazing mom and that it is safe for you to become pregnant. To wrap up, these are the important points we wanted to raise. Fertility preservation increases the chance for you to become a mother after you beat breast cancer. I should say one important thing, that most patients who do fertility preservation with us will actually get pregnant on their own. Those who do not get pregnant on their own have the backup of frozen eggs or frozen embryos. Fertility preservation is safe, as we have shown. There is no increase in recurrence and no shortened survival. Eggs survive well in freezing, and fertility preservation is possible even with chemotherapy first before surgery approach. If you carry a cancer gene, your embryos can be tested for the gene, such as BRCA, and therefore we will transfer an embryo that does not have the cancer gene, and your child will have an open future without increased cancer risk. Eggs and embryos can remain frozen as long as is necessary. Most oncologists recommend 2 years on tamoxifen before taking a break to conceive, but that is highly individual and always awaits clearance by the oncologist. You may still be able to conceive after breast cancer, even if you haven't preserved your fertility. And this is just a cute ending. We know babies are such a nice way to start people. And Albert Einstein said, there are only 2 ways to live your life, as though nothing is a miracle or as though everything is a miracle. Thank you for joining us. We hope you enjoy the STEP program video series. For more information, visit us online.